Hi everyone, thank you for joining. I'm Esther Valentine. I'm a CF parent myself to Joshua, who's aged 8, and I'll be chairing your session this evening. So just a bit about myself and my involvement with the CF Trust. I've been a member of the CF Involvement Network over the past few years, and recently I've been working with the team here in reviewing the patient experience survey, which we're going to talk about tonight in some detail. So in terms of what's coming up, we've got an overview of the CF registry. We'll hear from our medical statistician, Yumi, about some of the key findings from the data collected in the paediatric survey. We'll hear from Jana, our next speaker, and she will present some of the findings of the patient experience survey conducted in children's CF services. Some of you may have been involved in filling out this survey. It's something that the Trust runs every 3 years, and it's really great as CF parents to be able to feedback into CF care and our experiences, and to help contribute to improvements in the services of CF going forward. So just a couple of call outs before we get going with presentations from Yumi and Jana. The call will be recorded. Questions can be posted in the chat throughout the session. We've already received some questions prior to kicking off today. We'll endeavour to come to as many of these questions as we possibly can. So without further ado, then I'll invite the panel to come and give an intro of themselves then. So Yumi and Jana, over to you.
Yeah, thanks so much, Esther. So hi, everyone. I'm Jana. I'm the Trust's Clinical Quality Improvement Manager, and I'll be speaking second, and I'll be speaking about the patient experience survey and our findings.
And hello, everyone. I'm one of the medical statisticians. I'm Yumi, sorry. I'm one of the medical statisticians that's part of the registry team at the Trust. And I'll be going over some of the results from the annual data report.
Thanks, Yumi. That's fabulous, and thank you, Jana. Yumi, over to you then in terms of the CF registry.
Brilliant, thank you. I'll just share my screen now, and hopefully everyone will be able to see it. So yeah, it's really nice to meet you all. As I said, my name's Yumi. I'm one of the medical statisticians. I was part of the team that produced the annual data report for 2022. So I'll be going over some of the results from this most recent report, and focusing on some of the pediatrics data. So just to start, there's a couple of polls that will come up. Obviously, there's no obligation to join, but if you do want to join, you can go to menti.com and then put in this code, or alternatively, you can scan the QR code that'll take you directly to the question, which is, what is your connection to CF? Just to start off and get to know the audience. I'll give it a couple of seconds. And just to say, if anyone has any questions, I think Natalie will be collating them throughout the presentation, and then we'll go and answer them at the end. But if I spot any in the chat that are quite easy to answer, then I'll answer them as we go along, but they won't get missed out. Oh, cool. So yeah, it's actually a really mixed audience. People with CF, parent of CF, a CF nurse, other people in the registry team who I work with. Lovely. Thank you so much. So I'll go on to the next slide just because of time constraints. So today I'll be going over a bit of an introduction to anyone who's not familiar with the CF registry, and go over some of the data results. So we'll go over demographics, treatment, burden of treatment, and then some health outcomes. So a nice wide variety. So to start off with, what is the UK CF registry? You might be really familiar with it or not. So it was founded in 1996, and the registry is a consented database. So that means that the patients whose data is stored on the registry have agreed for their data to be stored there. So yeah, it's a database and it stores data from CF patients, and it collects the demographic, treatment, and health outcomes data that is typically routinely collected as part of a patient's journey in the healthcare system. So it will be data that's collected from a patient's electronic health record, which is already existing, and then that information is put onto the registry so that we have a database that is dedicated towards people with cystic fibrosis. So after 2007, sorry, the management of the database moved to the Cystic Fibrosis Trust, who began sponsoring it. It's made up, the data is collected from 56 centers, 4 standalone clinics, and 75 networked clinics. And you can see the little infographic to the right there, which shows the distribution of annual reviews in 2022. So the majority in England. And every year, we collect over 15 million data points. So that's equivalent to around 1,000 individual data points per person every 12 months. So it's a huge amount of data, which makes it a really rich data source. And that can be used for a lot of different reasons that are kind of summarized into 5 main points here. So it can help people with CF understand CF and make informed decisions. Clinical teams can use the results to understand their specific kind of patient mix within their clinics. It can be used in clinical trials, long-term observational studies. So a lot of of the data can be used for research and in helping commissioners provide the funding to the NHS CF centres. So it's it's a source of high quality data with a high accuracy and a good coverage of the CF population, which makes it really useful for research. So the second poll is how many individuals do you think had an annual review in 2022 who are aged under 16? So there's 3 options to choose from, 3,803, 6,410, and 8,244. Okay, I'll move on just because of the time limit. But it's interesting to see it's a good mix of answers. So the actual answer is 3,803. So that's 37.1%. So that's this kind of bright purple part of the donut of the people who had an annual review in 2022 were under 16 and 62.9% were over 16. And if we compare this figure to 2012, a decade ago, 42.4% of the CF population were under 16. So the proportion of older people with CF is increasing and taking up a larger proportion of this pie chart here. And we can show how this is changing over time. So this is a population chart. And what it shows is the proportion of the CF population who are within a certain age group that you can see at the bottom there. So you can see the bars are quite, they're much higher at younger age groups. So more people with CF are a younger age, and then they become kind of a bit lower in the older age groups. The blue bars are showing the proportions in 2012, and the gold bars are showing the proportion in 2013, and we can play this video to see how that changes over time. So the gold bars are the ones changing every year, and you can see with each year that progresses, these bars become wider, towards the older ages, and it shows how the CF population is becoming older. So you can see the top bit flattening out with a lower proportion of younger people and people who are surviving on into older age. The more people with CF are living to an older age. And the second poll, I think I might have to move on because of time that I'm conscious of, sorry. But it's asking, so what proportion of individuals under 18-year-old receive any IV treatment? So this is an extract from the 2022 annual report. And the two figures I've highlighted are the proportion of patients who are under 18 and who are receiving a home IV, so that's 5.6%, and the proportion of patients who are under 18 and who had a hospital IV during their annual review year, so that's 17.1%. And overall, 18.5% of patients that I'm circling with my mouse here had an IV in their annual review year for 2022. So just under a fifth of under 18s. And then we can take these figures and look at them over time. So that's what this next graph is showing. This isn't a graph that's produced in the annual report, but it's made up of figures that I've taken from every annual report because it's really useful to kind of see how these figures might change over time and if there are trends. And you can see the hospital IVs at the top are around 30% of under 18s receiving a hospital IV in 2018. And this is decreasing to the figure that I just showed you from the 2022 report. And it's a similar kind of downwards trend with home IVs. And that's just explaining what IV antibiotics are, which I'm sure most of the audience know, that they're administered through the veins and can be given at home or in hospital. So on top of IV treatments, they are decreasing, but there's still a huge burden of treatment for people with CF. So for under 18-year-olds, this is a list of just some of the treatments that are taken. So 64.5% of under 18-year-olds are on DNAs. 43.8% are on just on bronchodilators. And I wanted to highlight on this graph here that 11.3% are on a combination of bronchodilators and corticosteroids, sorry. So it's combinations of treatments as well, which take up a huge amount of time and effort every day. And so for people who are responsive to modulators, it will be important to address the high burden of treatment. So there are trials such as CF Storm, which are looking into whether we can safely reduce the burden of treatment for people who are responsive to Kaftrio. Another piece of data that we look at are lung infections, which can really affect kind of the health of lungs long term if someone gets damaged lungs from an infection. So this graph is showing Pseudomonas aeruginosa infections, which is quite common among people with CF. So the bright purple ones where my mouse is showing is intermittent Pseudomonas, and the grey ones is chronic Pseudomonas, which is where you have chronic Pseudomonas compared to intermittent is where you have like a repeated positive isolate of Pseudomonas within a certain period. So it's technically defined as 3 or more isolates in the last 12 months. And the small dotted line is showing 2020, the proportion of patients within each age group who had these infections. The long dashed line is 2021, and then the solid line is 2022. So you can see kind of a decreasing trend in the older age groups for chronic. And for the intermittent as well, but it's not so clear maybe in younger age groups what is happening. But it does appear to be a reduction in lung functions. And then we can look as well, just highlighting kind of using all all the other previous annual data reports, we can look back further in time and see the reduction happening in chronic Pseudomonas aeruginosa is quite kind of large and revealing, I would say. So the greatest reductions has been in recent years. And in part that can be due to things like the COVID pandemic, where people would be less likely to catch infections from social isolation. And finally, I wanted to show a graph that is in our annual report, and it's showing the FEV, so the lung function of patients in different age groups over time. So overall, you can see there's a downwards trend as age increases, lung function decreases. The 2012, so the bottom bright purple line is in 2012, and you can see compared in 2017, lung function is higher across every age group, and it's the same for 2022, that there's been an overall increase in average lung function over the past decade. So yeah, lung function at annual reviews have improved. And that was everything. So I just wanted to say thank you to everyone for listening. And if you have any questions, I look forward to answering them later. And I'll move on because I don't think there's any more time for polls. Thank you.
Thank you so much, Yumi. Some really insightful information on the CF registry there, and I think we can all take some positives away in seeing those graphs improve as we've seen over the past few years, which is really great. Let's move on to Jana then. Jana's going to present us the summary of the patient experience survey findings, as well as the recommendations that are going out to the CF centres.
Hi everyone again. So I'm Jana, Quality Improvement Manager, as I said earlier, and I will talk about some of the insights from our patient experience survey. But before I do, I just wanted to give a shout out to my team, which you can see on the screen, and besides me includes Sophie and Fiona. So we're a small but perfectly formed team, and as a quality improvement team, we collect patient experience data. We also collect information about staffing within CF services, and through our annual staffing tool, and we work with CF teams to try and find out, where small improvements could be made to improve care overall. And so one of the key kind of activities that we lead on is our patient experience survey in paediatric care. And this runs every 3 years. And we started this back in 2019. So that was the first cycle of the survey. And we then repeated it in late 2022 until March last year. So the analysis of the data was then done in the summer and a report published in the autumn, which you might already have seen. But I know my colleague will be sharing the link to the full report in the chat. Because of course, I will only be able to talk about a tiny proportion of the information that we gathered. There was so much. And just to say, so the survey is voluntary, and CF services are invited and can choose to take part. And we're really pleased to say that 28 of 32 paediatric centres did take part last year, and we gathered over 800 responses to our survey. So if any of you responded to the survey, thank you very much. The data that you provide is really invaluable, and it helps us, but it also helps your local teams. So obviously with the pediatric survey, we will have a lot of parents who are responding, but we did also have a few responses from teenagers and young adults themselves in the survey. And I'll share, of course, some of the issues we identified, but I first wanted to start us off with this kind of a positive message, because I think it's really important to recognise that the underlying tone of most survey responses was really, really positive. So overall, we find repeatedly in our survey, CF teams are doing a really, really good job under quite challenging circumstances. And so I wanted to acknowledge that, because that was the underlying tone of many of the comments. And I'm just sharing a few of those here on screen to give you kind of some examples of the lovely things people said about their CF teams, saying they were excellent, they provided holistic, seamless care, they were always there for them along the way. And hopefully some of that does resonate with people on the call today. So overall, really our finding is that CF care is of a really high standard and is appreciated by most people who receive it. So having said that, nothing's perfect. And so I will move us on to some of the aspects in the survey where issues were flagged. And one of the areas that we do always ask about is access and support from the CFMDT. So whether people can access different members of their CFMDT multidisciplinary team when they need them, and what the root support that they then receive is like. And so before I show you what the survey showed, I just have a little poll, which I hope will pop up on screen for those who are joining us live. So the CF parents on the call and people with CF, if you could kindly let us know, if you've ever had problems accessing your team, or if you've not experienced any such issues. And when we say members of the CF team, we do mean all the different specialties of doctors, nurses, physios, dietitians, and some of the others listed here, whoever might be available in your MDT. So if you could answer the second question on screen. I can see there's two popped up. The first question isn't actually for right now. Apologies for that. I can't actually see the results of the poll, I think. So I'm unsure if someone could pitch in to tell me what the poll showed.
Just giving people a couple of seconds to answer, Jana, and we'll share it.
Great, thank you. And is the second question to answer? Not
it is, yes, yeah.
Fantastic. Yeah. There we go. Thank you so much. So I can now see the results of the survey, and 74% of you saying that you never had problems accessing your CFMDT, and I think that's, that's really great. So that means that you can access support when you need it, and that's really what we want to see. But then, quite similar to what we saw in our survey, actually, I can see some of you said you had issues, rarely, but there were occasional issues, and others say sometimes. So actually, that's really kind of similar to what we saw in the survey itself. So I'll move on the slide. And don't be afraid of this slide. There's a lot on it, but I'll walk you through it. So as you can see, they're the top 4 kind of core members of the MDT: doctors, nurses, physios, dietitians, the kind of traditional roles. You can see lots of purple there, and purple is the proportion of respondents in our survey who said they could always access these members of their CFMDT when they needed them, and lots of people either saying yes, they could do this always or most of the time, very similar to what you just said. But then I'd like to draw your attention to the bottom 3 rows, where you can see some of the other specialties that should be available in CF teams: psychologists, social workers, and pharmacists. And you can kind of ignore the bit to the right, which is grey, which is people who said they felt they hadn't needed support from these staff groups. And I'd want you to focus on the turquoise kind of greenish bit in the middle. And while those are relatively small proportions, so 7.4%, 13%, and 9.2%, those are the people who said that they needed support from these members of the CFMDT, but they weren't able to access them because no one was available. And obviously, we don't really want to see any green, because there's an impact to not being able to access staff when required. And some of the comments left in the survey also kind of reflect that. So someone saying our clinical psychologist retired, and we've had no replacement available. I eventually sought the support privately. It was distressing and upsetting. And of course, seeking support privately is also not an option for everyone. And someone else said the social worker issue needs resolving. Since previous social worker left, there's barely any involvement, and the lack of a pharmacist. So that's something that really came out of the data. And I won't spend much time on this slide, but I just wanted to say the second question, after we asked about being able to access staff, we then asked people to rate the support that they received from the members of the CFMDT when they did get seen. And here you can see lots and lots of purple for all the staff groups. So we really see that there are issues around access for some of the staff groups, but once people are available and if they get seen, everyone is rated really, really highly by parents of children with CF and young people with CF. So that's greatly reassuring, and there just seems to be that access issue that needs to be addressed. And so from these data, we developed recommendations, and Esther and another CF parent actually worked with me on these, like she said earlier, and it was brilliant to have their insights. And I cannot share all the recommendations we came up with. They're all in the report, and we'll share the link to that in the chat so you can have a look. But just some of the recommendations that came out of this bit of data around access. are of course centered around there having to be access to psychosocial support and also to pharmacy. There ideally being involvement at annual review of these staff groups, and also people need to be clear in who they can contact out of hours about CF. So in terms of actions we've taken from this since, so all the CF teams that took part in the survey have got an anonymized report of survey responses from people under their care. So they know exactly what you said, but not that it's you. They can now use these insights to, hopefully think about what changes that they could make to address some of the issues that were raised. We also use these data to support our advocacy and campaigning work. And in October, we published a report called Supporting Crisis, the Unseen Costs of Cystic Fibrosis, where some of our PREMS data from the survey was actually used. And we're now starting to explore nationally what some of the issues are around the gaps in psychosocial staffing in CF. So that's a project that's come out from this work. Another part of the survey is asking about future preferences. Now, I think this is incredibly important because it gives CF teams a bit of a steer of what people under their care are really thinking in terms of some of the formats of care and how care is delivered. And so one of our questions is around the format for appointments. So as you know, since the pandemic, lots of care has gone virtual. Since then, some care has come back into the hospital. And so we do ask in future, what would be your preferred format for your appointments? And as you can see there in the kind of turquoise color, nearly half of our respondents said that they would prefer to continue with hospital appointments primarily. And then another large chunk, 40.3% in the purple, said that they would be happy with a hybrid approach, so some virtual, some hospital care. And unsurprisingly, some of the reasons people gave make absolute sense. Lots of parents who would like to be seen in hospital by their teams mentioned that they like the reassurance that it gives them because they're not medical professionals themselves. So that was the kind of overarching reasoning. Whereas parents who felt that a hybrid approach would work for them often mentioned travel costs and difficulty getting to the hospital. Some also mentioned issues around infection control and worries around that. And many said actually, if their child is well, they would quite like to be seen virtually, but if there's an issue, they'd like to come in. So that kind of shows us that there's a real need to continue to offer both formats and for CF teams to have the capacity to really do that. Another preference we asked about is IVs. So as Yumi mentioned in the registry data, we can see, which is brilliant, there's been a drop in the need for IVs in children, which is fantastic. But of course, there is a small proportion who will still need IV antibiotics from time to time. And for those who had IVs in the last 12 months, we asked about future preferences. And as you can see there, over 60% saying they'd like to have IVs at home. And some of the reasons given quite similar to the appointment preferences, actually, people living far away from hospital and it being quite difficult. So it's easier. Some people mentioning siblings they need to look after and childcare issues, and lots of people speaking about it being less disruptive. So for us, that kind of meant that teams should have the capacity to not only deliver face-to-face and hybrid care, but also to offer, where that's feasible, home IVs to patients, and obviously training around those home IVs as well. And that it's also really, really important, and I can't stress this enough, to talk to families about preferences, because everyone's different. And of course, the results of the survey do show that in a really helpful way. So again, teams have been given their bespoke feedback, so they know what kind of their patient population fed back in the survey. And we're also now highlighting the need for kind of that continued capacity in CF teams to deliver virtual and face-to-face care and home care to kind of major stakeholders like NHS England. And before I finish, there was one more thing that I wanted to share, and it's again just kind of a taster. So the last question in our survey asks, what could your CF team do better? And it's a free text question. And I think this actually generates some of the most interesting insights and lots of great suggestions of how teams could improve things. So again, these are all shared with teams directly, anonymized, of course, so they can see kind of what suggestions you've been making. And just to give you a few examples, here's people speaking about more consistency in care, better infection control, issues with receiving medications at home, and all of these kind of issues that many of you will probably be very familiar with. But this kind of helps us to feed that back to teams and make it clear that, you know, this looks like it's an issue for quite a lot of the families that you're looking after. Maybe it's something you should really pick up. So from all of those comments, and there were hundreds, we developed lots of other recommendations. They're all in the report if you want to read it in full. I've just put a few up on screen to give you an example. And as I said earlier, Esther was absolutely vital in supporting us with that. So some of it around it, kind of communication style, taking into account preferences, efficiency of clinics. And as I mentioned earlier, a lot of comments around issues with home care deliveries. And that was fed forward to our public and policy affairs teams, who actually then collected more information and submitted all of this as evidence to a House of Lords inquiry. And that's now reported and did create some of our evidence. So it's you know, fantastic. This does go places and it does inform policy and changes in care at local level and further. So that's me nearly done. I do have a second poll, which unfortunately we already asked earlier, but I don't know if we can launch it as a single poll again. But from the many, many recommendations we came up with in the survey, we kind of developed 5 overarching key recommendations, and they're now shown on screen. And the hope that I had was that I could ask you to pick your favorite. I know we have the results from the first one, so either we can show that again, or you can have another go at answering question number 1. Sorry about the issues with the surveys there. And these 5 recommendations essentially were all informed by what people in the survey said. So they're obviously equitable access to specialists. That's the kind of core thing that I showed you earlier with the graphs. Continued access to face-to-face and preferences being taken into account. Issues around communication and feedback from tests. Access to care in the community and infection control. So really interested to kind of hear your thoughts about which should be priorities. And I'm sure you know they're all really important, and we are trying to tackle all of them, but it's just really helpful to see which ones resonate the most with you and where you think the biggest need is. So I'll give you just a couple more seconds to respond to the poll, but I will move on with the slide if it's letting me. Great. Yeah, I did want to share this slide at the end. It does still show the key recommendations, but it just also has the link to the full report, and just confirms that we'll be running the next cycle of this survey in 2025-26. And so we'd be super grateful for anyone who gets invited to respond then. And the results of the survey are in, brilliant. So lots of people actually saying good quality communication and timely feedback. That's so helpful. And I think that was an issue, particularly the communication side and the delays with test and AR feedback. That was something that came up really highly, but actually quite an interesting distribution there. The only one that people seem to feel wasn't as important as the improved infection control. And I think that reflects the results in the survey as well, because a lot of people actually said infection control was really good in the CF team area, but maybe not so good in other areas of the hospital. So that is probably less priority than the others. Great. I've gone 1 minute over, apologies, but yes, thank you very much for that. And I'll hand back to Esther, I think.
Thank you for that, Jana. Fantastic summary of the survey findings there and the recommendations that went out to the CF centres. I think as a CF parent, really looking forward to seeing these recommendations being implemented and care being improved in the future. Thank you for that, Jana. So we move on to the final part of today's session, then it's our question and answer session. Been keeping an eye on the chat, so if people still want to pose some questions, please feel free to post them in the chat just there. We have some pre-questions that we've received as well from the audience, so we can start with those whilst we wait for other questions to come in. So the first question I have is, what is the Trust doing to address some of the challenges that were highlighted in the data? I think that's probably for both Jana and you, me, to answer perhaps.
I'll get started. I mean, I did touch, I guess, on some of the stuff, but it's great to get an opportunity to expand a little bit. So one of the kind of key tasks in my team, and I have a dedicated role in the team for this, is to follow up with CF services and offer support once we've provided them with data feedback, because teams are incredibly busy, and these kind of reports can get filed away in a drawer. So we've got a member of my team, our impact officer Fiona, who is there to support services, to maybe provide a PowerPoint version of their results, run a session with them to do a process map to kind of delve deeper into maybe a challenge that parents flagged for the service, and to help think about solutions as well, and come up with kind of a plan or a project to improve. So that's one of the things that we're doing, and we've started doing, and we're hoping to kind of gather case studies from that as well. And then, of course, I did mention some of the work that our public and policy affairs team are doing, which is absolutely fantastic. And they're using a lot of our data as a starting point and as evidence for their campaigning and their advocacy work. And just to give you the example of the House of Lords inquiry that we submitted evidence to about the issues around receiving medications like Kaftrio by the home care companies. And I think, that kind of thing, it does make a real difference. And so that's what we're doing. And we're now also starting a project to look at the gaps in psychosocial staffing and why there aren't, CF psychologists and CF social workers available everywhere, and what we can maybe do to do that. And we're doing that jointly with the UK PPCF, which is the professional group for CF psychologists and social workers. So it's kind of sparked work, and we're hoping to take things further.
Fab, thanks, Jana. Yumi, did you have anything to add from that from a registry perspective?
Yeah, sure. I think with the registry data, in terms of like challenges that are posed, the annual report and things like that are there to kind of show the trends, and for other people to identify the challenges and what can be done. For example, in terms of like research, identifying the challenges in CF care. So the registry we work with the research committee and the registry committee to make sure that the work that we're doing is aligned with the overall priorities, and anything else any other needs that come up within the community. And then in terms of like challenges for the registry, we have like for example, an annual report meeting every year where we get feedback from people like CF nurses and clinicians, and feedback in terms of making the registry itself better year on year in terms of like the quality of the data and what we collect, again to make sure that it's still aligned with the priorities and needs of the patients.
Sure, that makes sense, Yumi. I think we can see how the CF registry data really complements the patient experience survey, that they both sort of go together in terms of telling the story of CF care. Okay, let's move on to the next question then. How do we educate the centres on these findings? Can we discuss their feedback and what they will be doing?
I'm happy to go first.
Yeah, go for it.
With the registry data, one of the things that we do in terms of feeding back to the clinics is that every year we produce bespoke reports for those clinics, which summarize, for example, some of the data that I showed today, but for their specific clinics, so that they can understand the data of their clinic in more depth, and not just kind of like an overall population view. So that's one of the kind of feedback mechanisms that we have. And we also, I think, Jana, this might kind of lead into what you might be saying, but we have like we produce kind of bespoke, we are producing bespoke joint reports which kind of bring the registry and the QI data together, which is also again fed back to the clinics.
Yeah, absolutely, exactly. So as I mentioned, so my team prepares kind of bespoke summaries just with the patient experience data, and also staffing data, which we collect actually using the UK CF Registry platform. So again, an overlap with the registry team there for the staffing data. And we provide that when the data is kind of hot off the press. immediately. But sometimes, things don't necessarily happen immediately. And so recently we actually also implemented a new, more holistic data feedback report, which Yumi just alluded to, which brings together a centre's patient experience data with their staffing information, with their UK registry key outcome information, and some ideas and suggestions for QI, but also highlighting some of the existing good practice that exists in those services. And then we can follow up with services, and we offer to present the results to them if that would be easier, instead of reading a really long report. So that's what we're doing in order to follow up with them. And all the centres, even the ones that don't take part, are sent a copy of the reports that we publish, the ones you find on our website, so that they can benefit from the recommendations, even if maybe they don't have direct feedback from their population.
Great, thanks for that, Jana and Yumi. We've got a question in the chat here from Gemma. Do you think that every 3 years is enough for the patients to give their feedback in order to capture any shortfalls and give recommendations? A really good question there.
Yeah, absolutely. Yeah, I mean, it's really difficult, isn't it? Because on the other hand, you've got the problem of surveys going out left, right, and centre, and lots of people saying, actually, I'm not going to complete that survey. I've just done one, and so you kind of need to get the balance right. And when this was developed back in 2018-19, we had a lot of discussions around the frequency, and we felt that 1 year, doing it every year would be very, very burdensome for everyone involved, and probably wouldn't even allow services to make any changes and then see the impact of those changes. So what we do is we run this big national one every 3 years, and that obviously is really powerful because it allows us to feed back to services their own data, but then also give them something to compare themselves to with the overall findings, and see, if their population is saying exactly the same things, or if maybe there are problems being flagged that are a bit unique to them, and maybe if there's best practice they could learn from. But yes, so I think 3 years we ended up on because we wanted to give the service at the time to kind of implement changes and see the impact of that in the next survey results. But when we work with services directly to kind of do local changes, we actually encourage them to collect patient experience data and feedback as they go with that kind of live to see the impact immediately. And then what they would do is see a bigger impact, hopefully, by the time the big survey runs around again. But yes, it's just the frequency of surveys and giving people a chance to actually make change.
It's a balance, I guess, isn't it, between overburdening the CF centres with surveys versus actually giving them enough time to implement it.
Yeah,
that makes sense, Jana. Another question here is around the MDT. So the question is, I'm guessing that the psychological and social pharma is a consistent gap over the years. What do we think will change this year? What can the CFT do to support in areas where there are gaps?
Yeah, really, really good question, and absolutely correct. So the surveys that we've done to date have all kind of highlighted that there can be access issues around the psychosocial staff, so CF psychologists and CF social workers, and also pharmacists. But so we have actually seen a slight improvement. I wouldn't say that it's significant, and I certainly wouldn't say it because I've got stats colleagues on the call, in the overall proportion of people. So we've seen a bit of a drop in people saying they can't access these staff groups, which is great. We're not there yet, but we have seen a bit of a drop, which is kind of reassuring, and maybe there were issues that have now been resolved. But we do continually see problems in those staffing. And so, as I mentioned, we've got this new project going now with the UK CF, and don't ask me what that acronym stands for, I don't remember. It's the group of the psychologists and social workers who work in CF. We've got a joint project where we're going to explore what the gaps, why the gaps exist. And one of the reasons we need to do that before we can start properly trying to address them is because there might be gaps for very different reasons. So, for example, if a service has a role for a CF psychologist, but it's vacant and they just can't find someone to fill it, that's a very different problem to another service not having maybe the funding for that role, so they don't even have a role that they can advertise. And so we need to kind of figure out what are the issues, why are people not applying for these roles potentially as well, are there enough opportunities for people to do CF related continued professional development and get into a health professional career in CF. And so we want to explore that now first with the professionals in collaboration, and then we're going to try and see what we can do as a trust or they in their professions to kind of start to tackle some of that. But reassuringly, at least, we've seen a bit of a drop, and we hope that will continue next time we do the survey.
Yeah, we have seen a bit of a job, haven't we, Alex? Remember the survey from 3 years ago, there was a bigger gap. So it's good to see improvement happening in that space. A bit of work to go yet, by the sounds of it. I know in the recommendations in the survey findings, I know there are even more. There's a finer breakdown, isn't there, of things that can be done in order to address that. I think one of them was around ensuring that CF parents have got all the contact details and are reminded once a year who those contacts are. So all of that helps as well. Okay, another question for Jana is around the, so it's actually a question I've often asked myself with the modulators that have come, that we've been able to make use of now. Given the reduction in contact for many children with CF due to modulators, is there a risk that children are falling through the cracks now?
Well, I think it's a hard question, isn't it? I think there's always a risk anyone could fall through the cracks in a healthcare system. And that's really why everyone needs to work really hard to make sure that that doesn't happen. And I think there's a role both for parents to play, but also for the CF teams. And some of that stuff that we spoke about earlier, and you just mentioned as well, around contact details, making sure people know who to call, making sure that there is at least once a year regular access, whether a child is well or a child isn't well. There needs to be once a year access, and that's also in line with the standards of care that CF teams should be following. And so I think some of the issues that we highlight, like there is a percentage of people who don't know who to contact out of hours. That's a problem that might make it more likely someone will fall through the net. They don't know who to contact. They go to A&E instead of actually contacting their CF team. So I do think there's a lot to be kind of aware of. If your child is well, make sure that you still keep all the contact details for the CF team, and that you do attend any appointments that you're invited to. And then the CF teams equally, need to ensure that there's contact, and that if people change in the CF team or contact details change, that everyone who's under the care is really made aware of that.
Sure, thanks, Jana. I've got another question here from Louise. Does the registry capture information about about whether someone with CF is referred or treated elsewhere in addition to the CF MDT teams? So, for example, an ENT specialist, orthopedics, transplant, etc. Therefore, building a picture of additional teams involved in caring for a person with CF and or additional health issues.
Yeah, at the moment, we don't capture any data about referrals and teams that people have been referred to. We do, however, capture when someone starts on their transplant journey.
Okay, thanks, Yumi. That's useful to know. And I guess if there's anything related to CF, like liver complications, that would be tracked as well, or CFRD.
Yeah, so an individual might kind of be seeing multiple teams, multidisciplinary teams. For example, if they have a complication like CFRD, or like you said, elevated liver enzymes, but because we collate data that is captured as part of someone's electronic healthcare record, it will be put onto it will be collected by the registry. We just don't have the variable that says kind of whether someone's been referred to a different team.
Sure. So yeah, that makes sense. A question from me actually as well. I noted in this survey that there was a couple of centres that didn't participate this time round. How do we encourage all the centres to participate, or as many centres as possible?
Yeah, great question. I ask myself this every time we run the survey. And of course, there are different reasons. So we do try and follow up with the centres that don't participate just to find out. So we reach out to all centres over the summer. And I have to admit, you know, the occasional centre, it might be that the emails get lost, and they get in touch a little bit late to take part, and that has happened. You know, but other centres might have really good reasons for not taking part. So, for example, we had one centre that had just very recently done an internal patient experience survey, and they literally felt that it would have been too burdensome to send out another one because they'd done it as a local project for, I think, one of their nurses. So they said, we won't take part in this year, but we'll take part again next year. You know, we've actually seen an increase this last time we did it compared to 2019. So I've been really encouraged by the number that has taken part. We've also, admittedly, of course you learn, we've also improved the survey and also improved the reporting that we do. So the summaries that the centres get and how useful they are. So we've been speaking to centres and we've improved them. So I'm hoping that over time, I mean, we were only missing 4 centres in the last cycle. So over time, we'll hopefully be able to get more centres involved. But something else that we've done kind of as an alternative is we have actually posted about the survey on our social media channel and have said that it's going on. And if someone from a centre that isn't taking part wants to complete the survey, they can click the link and their centre will be listed, so they would be able to respond. And what I'm hoping to do is then to share, if there is any response, to share that with the centre, even if it hasn't taken part, so that hopefully next time they'll want to take part to get more responses.
And they'll get the benefit of seeing the data regardless anyway, at the very, very minimum. That's good to hear. Another question in the chat from Spencer's Daddy. Question for Yumi. Is there a piece of data that we don't currently collect but think we should do?
I guess it would be like my personal opinion, but it's actually really related to Louisa's question of whether we have data about referrals to multidisciplinary teams and people falling through the cracks with modulators. So, for example, if someone has a transplant, then they start their transplant journey and they'll be part of a transplant team that take care of them from then on. And so I think it would be a really useful piece of data to still be able to have the data of someone who started their transplant journey. Their lung function kind of might improve, and they might feel like they don't need CF care or something. But yeah, I think it's good to kind of, it would be useful to capture like a full transplanted patient's journey.
Yeah, absolutely. I just see I've received my 2-minute warning. I think we've got time for maybe one more question from Gemma. What percentage of patients took the survey? I know it was about 820, but out of how many received it?
Yeah, excellent question. And the short answer is I don't actually know. And that's simply because the way that the survey is sent out is through CF teams. So we support CF teams with getting paper copies of the survey and we give them the link, but they advertise the survey out to their patients. So the only data I have is what percentage of people from each centre that are in theory under the care of that centre completed the survey. And that, Gemma, actually varied quite a lot and really depended on how much the centre advertised the survey and sent it out. And it ranged from about 1% of a centre's population, which is not very meaningful at all, to over half. So we had one centre with well over 120 responses, which would be really, really good. So obviously that is something that is a limitation to the data because different services advertise the survey differently. And it would be great to drive that number up so that we have a more representative sample. And that's my goal for the future.
Absolutely. Thanks, Jana. Some great questions there. Thank you to everyone who posted in the chat. And just about to wrap up now and say thank you to everyone who joined us this evening. Hope you found it useful to hear about the key findings and the recommendations that went out as part of that experience survey. Thank you to our speakers, Jana and Yumi. You provided a wonderful insight into the CF registry and the recommendations provided to the centres. I think we can all look forward to seeing those being implemented, and I think we can all see as well how it's really useful to look at both outcomes and experiences together to get a view into how our CF centres are performing and our experiences as parents and families with CF. So just a couple of more slides to go on things that are coming up. So there's an involvement meeting happening at the end of February. So here you can hear from members of the involvement group, such as myself and trust staff, about the various involvement opportunities and how your lived experiences and insights influence the work of the Trust and future CF research. This will include how CF parents have taken part in involvement activities, which have shaped some of the new resources that will be launched over the coming months. So do join if you're available on the 28th of February. Then February, not to be confused with February. This is our annual fundraiser held in the month of February, where we encourage everyone to come together over a cup of tea, a slice of cake, to raise some vital funds for everyone with CF. There are more details posted on screen and in the chat about that. And finally, Team CF. So if anyone feels inspired to get involved in fundraising challenges with various events taking place across the year and across the UK, more details are available on the website, on screen and in the chat. And finally, just to wrap up with a bit of admin to say that the recording will be available to everyone who signed up in the session. We'll also send out a feedback questionnaire. It'd be really great to get your input on how this session was. It helps us with future events. And just to say once again, thank you to everyone. Thank you to everyone who joined, and we hope that everyone has a really nice evening. Take care, everyone.
Thank you.
Bye-bye.
Thanks so much, Esther. Brilliant sharing there. Thank you.